Dr. Dani Cabral here. Thanks for joining. So today we're going to talk about tips for helping a resistant family member to get in a memory evaluation. This may be one of the most challenging things that we'll experience for ourselves and our loved ones and as family members and professionals. And our systems and society here in our culture are not well equipped to handle this. So there's a lot to discuss, and I welcome any questions or comments. Now, you may be here because you yourself have a family member or friend that you're hoping will get a memory evaluation, and maybe you've asked them gently and they've refused or resisted. So today I'm going to talk about some common reasons why this happens, and sometimes these are things that people don't realize are going on, and then how we can start to change our communication style and think about how to best have everyone's needs be met in the situation, and so some practical steps for doing that. I am going to share my screen now, and let's get started. I found this great paper that was a systematic review that showed that over the last 30 years, looking at barriers and facilitators, so things that helped people pursue a dementia diagnosis, they've pretty much stayed the same over the past 30 years, which is discouraging yet. And so there's room for improvement. And I just thought it'd be helpful to start by laying those out so we're all on the same page. So barriers include denial, stigma, fear, lack of knowledge, normalizing symptoms, preserving autonomy, the lack of perceived need, unawareness of changes, lack of informal network support, care difficulties, and then problems accessing help. Now, these papers were mostly done interviewing the family members, or what they call the carers. I think only 4 of these papers out of 32 were able to ask the individuals with dementia. So these are the care partner's perspectives on what's going on, whether they think it's, say, denial or stigma, for example. And I would just add that the family members as well, and I'll talk more about this in a minute, are going through a lot of these things for themselves in their own role and space in this situation, and often this is unacknowledged, and there's a lack of awareness as well of that relational component. Many more barriers they found than facilitators. So the facilitators of getting pursuing the evaluation and getting a diagnosis were recognizing the symptoms to be a problem, prior knowledge and contact. So prior knowledge and understanding of dementia or Alzheimer's disease, and contacts in that world, whether they be formal or informal professionals, and then support from their informal network. I think it's helpful to step back before jumping into what are the common causes of resistance, to talk about what are the benefits. Why is it important to have a memory or cognitive evaluation? Why, as a family member or friend, are you going to go through all this effort with a person who's refusing or resistant? Well, there's many, many reasons. These are just some of them. So it's likely that the person who's having the memory loss, and also the family members, everyone is experiencing some kind of fears and uncertainties and anxiety. And to take the steps to move forward with the evaluation and then to get some kind of diagnosis or more information really does benefit people a lot. And to be able to put words to what's going on, even though they're scared and concerned about doing that, people often feel a sense of relief when they finally do get more information. If you're dealing with this for yourself and your loved ones, it's very likely that different family members have different feelings about whether the person has enough cognitive issues to pursue, to require some kind of evaluation. So getting everyone on the same page is so valuable when you go through that process. Getting an evaluation helps to address, identify and address potentially reversible causes and highly treatable causes. I would say a big one is medications with older adults, on several medications, and they may be on not only on medications that they don't need or that are causing cognitive impairment in different ways that could potentially be deprescribed. They often may be mismanaging their medications due to the cognitive impairment. And so getting on a better medication management system can be so valuable and help the person actually feel a lot better. Metabolic issues, hearing and vision loss, depression, sleep issues. So these are very common causes of cognitive changes in older adults and quite treatable. Getting an evaluation gets you access to care, resources, support, treatment sooner, more effectively, decreases potential for safety risks and crises. And those themselves can be traumatic and costly. And so waiting for that to happen, which is not uncommon for families for many reasons. Unfortunately, sometimes the crises that occur can be quite devastating and actually lead to that person having a very significant decline in their cognition function, and say even needing to move out of the house abruptly into a supervised living situation. So want to avoid that if possible. Getting an evaluation and a diagnosis allows everyone to adapt to these changes if they are chronic and progressive, like a neurodegenerative disease, like an Alzheimer's disease, and allows people to take control and feel empowered. So that's more focused, those are more focused on helping the person who's going through the cognitive change. But if we think about the family members, how they fit into this and how this can help them also. So they can feel supporting their person to be as independent as possible. And I'll talk about this shortly, that often family members, if they're faced with resistance to their person getting evaluated, they don't want to overstep them or overstep their autonomy. And so they feel they're being respectful by upholding their person's refusal. When unfortunately, in reality, by not addressing this, that person can lose their independence more quickly because they're not getting this support, this adapted, slowly increasing support over time. And they can have a worse course without that support. And they maybe not be able to engage in the things that they want to engage in. It allows the person to take more of an active role in future planning. And that's really valuable, especially for, say, either an adult child or a spouse, to feel like they're in it together with the person and they're able to solicit that person's opinion about what their life is going to entail. And that can happen if you get this evaluation sooner. So we talked about avoiding crises, such as, for example, suddenly having to take away the license and the driving privileges, suddenly having to move the person into a supervised living situation, or suddenly they have to be hospitalized because they had a fall and a hip fracture. And so it goes from being well-intentioned to not pursuing the evaluation to suddenly that person's life is sometimes devastated, and maybe likely addressing this sooner and going through those difficult initial conversations could have avoided that. And then developing together as a family a shared understanding of what's going on, and then acknowledging and addressing your own fears, grief, changes in identity, roles, and relationship, and schedule changes that have to occur for care partners and family members to know what's going on. You can then figure out for your life, okay, how am I still going to have a life myself and do what I need to do? Maybe it's your parent and you have kids that are school age and you're working and you're going to have to figure out how you're going to do all these things. So it is helpful to get that information for that reason. Let's shift now to common reasons for resistance to a memory evaluation. So there are disease-specific related causes of resistance, typically causing decreased awareness. And then we have, I'll talk in depth about these in a bit. We have fear, denial, anxiety, and stigma for that person who's having the memory loss. And then what I call the action reaction pair. So a lot of family members, people sometimes think their person who's refusing is in denial, and they're just being difficult and stubborn, when in reality, oftentimes, and it's really difficult to quantify exactly how often, but it's actually the disease in the brain, and or if they don't have, say, Alzheimer's disease, whatever's causing their cognitive impairment is affecting their ability to think clearly. And so that could lead to things like short-term memory issues, executive dysfunction, which is things like planning, multitasking, organizing. So even if you have a family member who's like, okay, yeah, maybe I'm, I'm slipping a little, okay, yeah, I'll get the evaluation. They may, if it's only up to them to go follow through with the doctor's recommendations, like to go, for example, get an MRI at the imaging center and go have a neuropsychological evaluation. I hear all the time that person they forget, or, for some reason they don't get to those appointments. And so from the earliest stages, it's really important that you as a family member you're keeping tabs on things, and it may have to be from afar, to allow the person to essentially do them on their own if they're early on in their, they have mild symptoms, but it may be surprising to people how much they need to be aware of and be involved in what's going on right from the get-go. So other disease-related things that can happen, something called anosognosia. And so this is where there's little or no awareness or insight about the symptoms and the disease that's happening and how it's impacting the person's life. And this is due directly to the areas of the brain that are damaged by the disease. This was first described in 1914 by French neurologist Joseph Babinski, and it seemed that individuals who had damage to their right parietal lobe in their brain specifically would have this complete lack of awareness that they actually had any kind of symptoms. And so they would have left-sided weakness, and they would not realize it at all. There was no awareness of this, despite doing a neurologic exam and demonstrating right in front of them that their left side is weaker. And so this can happen with strokes, traumatic brain injuries, dementia, to name a few. And this concept is so valuable to keep in mind when you have a family member that you are trying to rationalize with them, and there's clear evidence right in front of everyone that obviously there's an issue and they're oblivious. And so keep in mind that this could be going on. And then impaired judgment. This can happen due to various kinds of brain diseases and issues. And specifically one that comes to mind is frontotemporal lobar degeneration, or frontotemporal dementia, with the behavioral variant. One of the initial symptoms can be that the person has some real significant changes in their behavior. They act impulsively, recklessly, and can do things that are devastating to themselves and their family, and they don't have any sense that these things are not appropriate, or even they may be doing illegal things, and this was never something that was in their life that they would have done. So this could all be due to the brain disease. Shifting to fear, denial, anxiety, and stigma. Alzheimer's disease is considered the most feared disease to get by many Americans. And so it's understandable that there's a lot of fear and denial. And how I've started to think about this is that the stigma that's associated with these diagnoses, say of dementia and Alzheimer's disease, is so profound and so embedded in our culture and society. And even, to step back, even aging, there's such a stigma and such an anti-aging culture that people try so hard and spend so much money to pretend not to age when we're all aging. fall, as soon as we're born, we're all aging. So, but when it comes to dementia, what I think is that it's many people want to uphold and preserve their own identity, sense of self. They want to keep living and keep contributing and engaging with the world. And when one gets these diagnoses, the reality is so many things are shut down. There's so much prejudice. And so this is actually, I think of this as a rational response for many people to having these, or to trying to avoid getting stuck with these diagnoses. And this is a big area that's not talked about and that we really don't understand. But I would say this is more of a rational choice a lot of times than we think. And research shows that care partners specifically express wanting to preserve and respect the autonomy or independence of their person living with symptoms, and in some cases had difficulty seeking help because they worried how their person would react. And so they're trying to respect their loved one, and they're following their traditional ways that they've communicated with their person. So say it's someone's spouse who they're noticing a change in their cognition, and it's been going on, say, for a year, and it's been getting slowly worse, and their spouse is saying, no, I'm fine, I don't want to get this isn't a big deal, this is normal, I don't want to get evaluated. It's very hard if you've been married for 20, 30, 40 years, 50 years to step in and say, no, I'm going to decide for you what you need. And so it is an attempt to continue to stay connected to that person, yet it's clear and known that this is probably going to progress. And so that fear is always there, and there's like a ticking time bomb feeling, which is scary for everybody. This is Newton's third law, the action-reaction pair. So Newton's third law states that an applied force creates an equal and opposite force. And the more you push and try to rationalize, and especially as for people, an individual who doesn't have much insight into what's going on, so they have anosognosia, or they're just someone that wants to really maintain their independence. Or I've seen this more also when someone's moving into the moderate stages and farther along, and that has to do with kind of the insight of like, what's the point of this? Why do I need this? I'm fine. I've had situations where it's usually in couples that have been together for a long time, where they have what I call it double dementia. One has mild and one has moderate. And it's very challenging. And I always try to bring in a family member if possible, or call in a family member, because trying to rationalize, I've noticed what can happen is they can, suddenly I feel like I'm a high school principal, and they revert to like, we're not going to do what you say. And they join together. And I just have learned to just sometimes call that out and say, like, this is, I'm not like your parent here. And so, again, that doesn't, rationalizing isn't going to be fruitful here. And we'll talk about that in a minute, but this is just always a good thing to keep in mind. Now, what do studies show are common triggers for finally pursuing a memory evaluation and engagement with a healthcare professional? This is in talking to care partners, witnessing a decline in the condition, family carers noticing the symptoms and agreeing that action together, but working separately from the person with symptoms. This happens after a disagreement where other family members finally acquiesce to the caregiver to get more information and work separately from the person with symptoms. Direct recommendations from contacts with healthcare professionals, crises, direct recommendations from other non-healthcare professionals, and then person with symptom being worried about their symptoms. And that turns out is far less common, that the person with the symptoms is the one who triggers the evaluation. Now, we talked about this before, and many of you in the healthcare system know that there's no required memory or cognitive screening by primary care providers except for the Medicare annual wellness visit, where there's a very cursory cognitive assessment done. And if the person is there alone and they're able to pass this very simple cognitive assessment, then there's nothing more that's done. So primary care providers often do not initiate memory evaluations unless prompted by the patient, or somehow if a family member is allowed to either present this concern, present information, or be present. And so, and again, I mentioned from the patient is rare. And it's really important. I don't think people realize in general that this is not going to be even asked about until it's causing these like crises or major safety issues, or a family member is like completely at wit's end demanding that they be a part of the visit. So this really needs to change, and we need to come up with a better system because, again, 7 million Americans have dementia. We're going to shift to talking about effective communication strategies. So if it's, let's say, you have a family member that you're trying to get to a memory evaluation. Before you talk to your resistant family member, remember why you're doing this. Remember why it's so important that they have a cognitive evaluation and all of the benefits and all of the trying to avoid the potential downsides of not having that and delaying that. You must know that your historical, typical way of communicating with this family member, this person, will probably not work in this situation and may lead to defensiveness and alienation. So committing in this situation for this purpose to a different way of communicating is crucial. And understanding that direct confrontation with the person will be counterproductive. And of course, that's not what you want. Now, this can be profoundly challenging depending on the relationship that you've had with this person over the years and how you've communicated. And if, say, it's a parent that you haven't necessarily had the best relationship with, but you're the adult child that lives closest, or you need to be the one to take care of them. And so this can be really challenging, and I don't want to take anything away from that. It's going to be difficult, and it can take many conversations and interactions, but that short-term effort will have major long-term benefits. The next point before talking to your family member is start with curiosity and fact-finding. And I always think about being a detective is what's going to be essential here. So observe them, as long as there's no active safety issues that you need to step in immediately. If you can observe over time, note these things, write them down concerning symptoms or things that are out of character. And then importantly, try to assess that level of insight and awareness. Is this more they're just being stubborn, or is it that they're whatever medical issue or disease is affecting them is causing a lack of insight and awareness, and they really can't engage in these conversations or take this on themselves? Now, we're moving to when you're going to talk to your resistant family member. Ask open-ended questions and with curiosity. So for example, you could say, do you feel like you're having any memory issues, or do you feel like there's been any changes in your thinking? This is a question I ask. I actually start every new patient visit with this question. I mean, it's different because I don't know these people and I'm the doctor, and it's a completely different dynamic than if it's your family member you're asking. But I first ask the person with the symptoms, have you had any trouble with your memory lately that you've noticed, or your thinking? And it gives me so much information because you say yes or no, Or it may be like, yeah, but it's, it's just like normal aging. So they're telling you so much there. And when the people that say, no, I haven't noticed anything, yet I've looked at the notes before and the records, and it's like, this person probably has moderate stage dementia. So they've been going through this for years and they lack insight. And that, that tells me that it's possible these family members, there's usually, one sitting in front of me, like they've really probably had a lot to do to help take care of this person who doesn't have any insight into what's going on. Now, you can say something like, an example is, hey, I've noticed you haven't filed your taxes yet like you usually do. How's everything going with that? So you're trying to focus on things that are unique to them, that has changed in their behavior, and just kind of gently probing. Avoid why did you do that? Why didn't you do this? Those questions really never work. Usually most people get defensive in any situation when you're asked. If you can avoid why, that is usually pretty helpful for good communication skills. Now, if you determine that insight and awareness is present, at least to some degree, you could ask, so what bothers you most about whatever, the cognitive changes, and how does that make you feel, and how can I help? Would you open to talking to someone about that? And that can all start giving you some really important information and opening the door to that. Now, listen. This is really challenging for all of us, especially in our modern day where our minds are usually spinning. So try to listen, just listen to their responses to this and their nonverbal without planning your response or stating your hopes or having the goal, like the point of me, like in your mind, the point of me asking these questions is because by the end of the conversation, I want to get them to agree to a memory evaluation. It's possible that could happen, but most likely what will happen if they're willing to engage you in that conversation at all is that they're gonna start thinking about this. It's gonna be in there in some way, and they may even come back to you in the next few weeks, or you may revisit soon and see if they've had any more thoughts about it, which they may or they may not have. All right, so let's shift to you started these conversations. So what are practical approaches to get them to go to the memory evaluation? So if you've broached the topic a few times and it's not going anywhere, and you've really tried to use those good communication skills, then there's no point in doing that anymore, and it's just going to lead to further division and alienation, and that's not going to be helpful. Now, I found this concept in my reading for this talk, and I find it really helpful that these researchers described families with a person with symptoms either working together or working separately. And so working together means you can work with the person with symptoms to come up with a plan to go and engage with the healthcare system. Whereas working separately is when you can't, and you yourself do it, is either a single family member or often getting at least one other person or family member involved to help move that process along. Now, you may need to work separately from the person with symptoms if there's a lack of insight or awareness. And if the person seems aware, but still adamantly refuses and safety issues are present. So I use the 3 yellow flags or 1 red flag safety rule that I'll review on the next slide. Now, you want to avoid rationalizing and explaining for a number of reasons. So whether it's because the person has cognitive impairment and can't think in that complex way, they can't hold what you first said and integrate it into the next point of what you're saying, or because you're stressing them out, they're becoming anxious. And any of us, when we're anxious, our smart thinking brain goes offline, and then we're just going into, emotional and survival mode. And so they're not going to be able to engage you in that conversation anyway. And so avoid rationalizing and explaining, which can lead to this avoidance, increased anxiety, and even sometimes paranoia. So, a family member that's constantly like, hey, do you remember what they're showing the picture, the family picture, like, what's her name? What's his name? And like that, the person with symptoms starts to associate that family member with like, they're trying to take over my life. And so that can lead to some paranoid feelings and avoidance of that. And you absolutely want to avoid that. So just to review, if you're in this situation, I say if you have 3 of these yellow flags, so that's frequent and slowly worsening forgetfulness, repeating information, difficulty following conversations, trouble with daily tasks, misplacing items, frequently language difficulties, changes in problem solving, and then feedback from other people. If there's 3 of those, this is concerning and requires an evaluation, or 1 major safety issue, 1 red flag. So if there's been a medication error, a fall, wandering, getting lost, cooking accidents, impulsivity or risky behavior, some kind of potential for self-harm, physical self-harm or harm to others, driving hazards or exposure to environmental dangers like fires. So if there's 1 of these, 3 yellow flags or 1 flag, it's time to get in with someone. And so I just think this could be a helpful framework for a family that's maybe resisting or dragging their feet and not wanting to pursue this. Because this is pretty clear, the writing's on the wall with this, that a crisis is going to happen, and that could be really bad for that person and for other people. For example, driving. If they've already had an accident, something could happen to themselves and other people. So let's talk about this decision to work separately. Now, this is really challenging because we really value being honest and open about, what are the facts in our society, and we can feel deceptive at first when we're not including the person in the decision to move forward with the evaluation. Now, we have a high cultural value on individualism, and our definition or our conceptualization of what is the truth, and we don't want to lie to someone. That's, from my perspective, that's detrimental at the end of the day to the person who is demonstrating cognitive impairment and really could benefit from talking to a healthcare professional and getting evaluated, because once again, there's many possible causes, many of them are treatable, and they could be feeling much better, have a high quality of life, and more be living the life that they want to live. Sometimes I think I say, if your family member, if this was 10 years ago, and you talk to them and you said, hey, if you start having progressive memory loss and you're doing things out of character, but you're saying, you're resisting getting checked out, even though, there could be something going on that we could address, how would you feel about, like, saying, if I'm the spouse, that I decide I'm going to overstep what you're saying because I'm concerned that your thinking is supporting not helpful decisions for your life. And then that person would probably say, yeah, like, let's go, make sure to get me evaluated. And really, ideally, we would have these conversations much earlier in our lives, and we could communicate to our family members like what your specific values and preferences are and goals. Remember your and your family's goals individually and together. Now, if you're going to work separately, ideally, you're bringing in another family member or, close friend or loved one if possible, because building a team and spreading the net here is so important, not just to getting to the evaluation, but because this is the, beginnings of probably many years of changes going on in their life, in your lives as a family. And so the more that you have more people who care and can help each other with this, the better. And that's what I've seen. So the more open family members are and transparent with each other, the better. Now, if you're deciding to work separately and say your person is pretty early, their symptoms are mild and they're good at, they have social graces, they don't seem to have anything going on, and everyone around them says, oh, you're fine. Like, I don't know what your, spouse is talking about. I don't know what your kid's talking about. Like, there's nothing wrong. I do the same things. Like, you hear that all the time. So you could say something like, to approach the primary care provider, so if you're the child, my father has been showing changes in memory and behavior over the last years and now seems to be mismanaging his medications. He refuses to get evaluated, and I am concerned he has a medical issue clouding his thinking. Can you please evaluate his memory? So something like that, if it's nice and clear and concise and to the point, and you're asking them to consider doing this and not demanding, I think there's a good chance that the doctor or the primary care provider will try to move forward with this. And so hopefully this message can actually get to them to do this. Now, what are other practical approaches or things to keep in mind to facilitate a memory evaluation? Something I like to use is the carryover effect. Now, this is something that's not very well understood, but basically, it seems that if you can induce good positive feelings in a person who has, say, dementia, they continue to feel that way for some extended period of time. And so I'll give you an example. So when I'm in a visit with a person with dementia and their family member, and I have to tell them something that they're not happy about, like say we talk about, reducing their driving, limiting their driving. And that's not well received. They might be upset at some point during the visit, but we're able to get back to a better place because by the end of the visit, I'm talking about things that they're connecting to and they're feeling like themselves again, and they don't feel like I'm taking over their autonomy and their ability to be independent entirely. And so they leave the visit with positive feelings about me as their doctor, and that's so valuable. Not only because then the family member isn't subjected to a lot of negative experiences right immediately after, but also it seems that they're more positive about me when they come back for their next visit. And you can do that too as family members. So even if you're dealing with a challenging situation, there's a way to get back to a better place. And I think this is also where the short-term recall issue, you can use it in your favor, where they may forget the challenging thing that happened 10 minutes ago and how you just had a disagreement, and you get to a better place again. Finally, support your own wellness as a family member or friend of someone who's going through this. This should probably be number one on the list, frankly. So determine what is needed to keep your tank full, and that's a whole other conversation. Lean on your friends, grow your community, find people going through similar situations, and then engage in grief work. So what's grief work? I think this is the next frontier in this field. And actually grief is what drew me to this whole field of Alzheimer's disease and related dementias, because I was so fascinated with what I saw as all of the changes and losses that were happening over time. They were small and they were big, and they came and they went, and there were so many uncertainties. And how did people navigate that? And how can psychologically we handle that? The most common grief cycle is the Kubler-Ross 5 stages here that I'm sure you've heard of. So denial, anger, depression, bargaining, and acceptance. And this was created based on the experience of people dying of cancer. And so this model has been so important, but doesn't adequately capture the complexities and nuances of the grief experience in Alzheimer's disease for the person or the loved ones. And these researchers published this dementia grief model describing the unique grief experience of dementia caregiving. And so there's emerging connection between how much pre-death grief there is and post-death complicated grief in dementia caregivers. So complicated grief is a severe form of grief that causes separation, distress, intrusive thoughts, and an inability to resolve the loss even after it's, long after that trauma has ended. So that occurs in about 20% of dementia caregivers following the physical death of the person, and 30% of those people are at risk for clinical depression in the first year. Now, importantly, greater pre-death grief is a key predictor of post-death complicated grief, and then interventions to reduce burden and stress decrease the levels of post-death depression and complicated grief. Now, their model is a framework for understanding these experiences and then developing interventions. And so I'm bringing this up because if your family members or your patients, family members are going through this, having any sense that this is happening is so important. And even just being able to start these conversations can be so meaningful and therapeutic for family members. And that can have profound benefits in the short and long term. So the way these researchers framed it, so there's separation, liminality, and reemergence for the grief. Separation is the initial shock, disbelief, and anger at the loss of the person they knew. Liminality is a period of uncertainty and ambiguity where caregivers grapple with the changing reality and their own emotions. And then reemergence is a gradual process of adapting to the new reality and then finding meaning and building new relationships and connections. So they say each of these three states has a dynamic mechanism that propels movement through the process, and then failure of the dynamic mechanism is hypothesized to inhibit the grief trajectory and add to the emotional stress of the caregiver. And the goal of the grief is adaptation that generally signals resolution. And in dementia grief, it is the temporary finality as the cycle enacted repeatedly until physical death. So I'm getting more on board with how we need to really think about these diseases as impacting a cluster of people and not just one individual person, and then everyone changes to try to help that person, because the impacts on each person in the family or network are so profound and can have such long-lasting emotional, psychological, physical, medical effects. And we have caregivers who are young people too that put their lives on hold, that are in their even teens and 20s, and our culture and our healthcare system finds it so difficult to think about more than one person in the equation. But grief is so relational and dynamic, and really requires us to do this together as a community. And so I think that's really interesting and important that we start talking more about that. So in conclusion, there's many possible causes of resistance to a memory or cognitive evaluation. That could be brain disease and medical disease related, denial, stigma, fear, and preservation of one's autonomy and independence. Effective communication strategies to encourage participation include staying curious, listening more than speaking, avoid rationalizing, determine whether to work together with a person with symptoms or work separately. And then practical strategies to facilitate the evaluation are aided by awareness of the complex psychological experience for everyone involved, creating a support team and community, engaging in grief work, and then investing in one's own well-being as a partner in this journey. So hopefully this was helpful to you. All right. Well, thank you. Thanks for coming. We'll see you next time.